Good morning, everyone. My name is Eric Moorehead. I'm the program coordinator in the Division of Medicaid Long-Term Care. Today I'm going to discuss the 2017 and 18 eligibility enrollment process for the state. This presentation will outline the Medicaid categories, the income guidelines, resource guidelines, and the services offered from the Division of Medicaid Long-Term Care. But before I do this, I would like to go over the 2016 data that was collected, ending the fiscal year in June of this year. As everyone can see, the population of our clients is majority children. They encompass 67% of the entire Medicaid population within the state. But as you can see, the costs associated with that only was 27%. One of the smallest groups was our blind and disabled group. As you can see again, overwhelmingly, that is the largest portion of the costs within the state. Our children averaged right now, population is around 232,000 for the state. 156. The total population right now under the Division of Medicaid is around 235. Those are current stats as of last month. The primary eligibility requirements for Medicaid, first of all, start with an application. We need to receive a valid application, and that can be in the form of an online app, a paper app, or now we do have a phone app, which means that the client can call in and speak with a customer service representative and actually go through the application process on the phone. What contributes to a valid application is actually a signature. At the end, the client or a power of attorney must sign off on the application for that to be valid. Another part is going to again be citizenship and immigration status. To be eligible for the state for Medicaid within the state of Nebraska, the state is authorized to verify citizenship and immigration, and that's done through a multi-step process. It can be electronic, it can be the client providing documents to prove, but we do need to get that information to determine eligibility. And then, of course, they must declare to be a resident of the state. We have clients sometimes shuffle in and out of the state. There has to be a declaration that the intent is for them to stay in the state for that coverage to begin. And then Social Security number. Again, we require that a Social Security number be provided. The client, if the client's a newborn, we give them basically 90 days to prove that they are applying for that Social Security number. There are some specific instances where, based on religious or other aspects, that they may not get that. They have to provide that to the state for us then to provide a unique number that would be identifying to them. The cooperation with child support. So if the bio parent is the one that's requesting Medicaid coverage and they have a dependent child in the household, if there is child support in order, they have to basically satisfy that within child support to receive that coverage under Medicaid. The Medicaid categories within the state are listed on the screen. When we took over when the Affordable Care Act was passed, we broke our programs into two specific categories, Magi and non-Magi. As you can see, Magi is basically children up until the age of 18. And then we have the Children's Health Insurance Program, CHIP. I'm pretty sure everyone's seen in the news lately that CHIP was a funding that potentially ran out in September. Congress is yet to sign off on CHIP to renew that. The state is actively working on a plan if that isn't passed. So that category is still sort of up in the air. Parent, caretaker, relatives. Again, if parents have bio children in the household, dependent children, they're eligible for Medicaid as well. 599 CHIP is the program that covers the unborn child within the state. And that's for women that are ineligible for any type of other coverage based on immigration or other status as that. And let's see, subadopt and guardianship, again, that's a category that was provided by a bill within the state that was passed a couple years ago that says that anybody that's placed in the adoption through the state, it was a state ward, they can receive Medicaid coverage up until their 21st birthday. And then we have hospital presumptive as well. Our non-Magi categories are listed there as well. Most of these are going to be around the elderly or the disabled categories, and those are listed there. TMA, Transitional Medical Insurance, that's the program where if a client gains employment or has employment that raises them out of a Magi category, they can receive supplemental health insurance up to a year as long as they provide that information in a 6-month average. Our programs are built on FPL guidelines, federal poverty level, and those are updated, I think, semi-annually, so we'll get 2 updates depending on the timing of the year. And that's how our programs are broken down. It's strictly based on income level and household size. For our non-Magi side, we do have resource guidelines that we follow as well, and those are listed there. Again, these are updated based on FPL levels as well, so these do change semi-annually as well. Okay, the waiver program. So we have a couple waiver programs that provide services in specific instances where they may not qualify for standard care, and those are listed there. The state is really trying to go more towards a home and community-based, and so we have our aged and disabled population, and then anybody that suffers severe brain trauma potentially could receive a waiver services as well. And again, this is built on it's basically built on a service plan between the provider and the client, and is basically funded through the waiver program. Okay, so I'm sure everyone's heard the no wrong door approach. Within the state of Nebraska, there is really no wrong door. We have access points for clients to apply for coverage through the Nebraska Medicaid application process and Access Nebraska, and then also the federal health marketplace in the ACA. Healthcare.gov, their open enrollment starts, I think November. Yeah, November 1. Now, I'm sure everyone has heard that the coverage or the funding for the announcement of that has been reduced very much. And so, for clients out there, keep reminding them that if you do have contact, that November 1 is the start of that open enrollment. The budget has just been slashed as far as that that coverage. We do have brochures and other material on the back table. I forgot to mention that people can grab if you want to take them to your clients as well, to explain that coverage as well. But listed there, we do have 3 points of contact for the state. They can go into local offices, they can use the phone, or they can go through Access Nebraska. And Access Nebraska, we will go through a couple slides at the end of this presentation just to show that access. But that is a online approach for clients that have access through online to contact the agency and get questions answered as well. Okay, 90 days. So anytime a client applies for coverage, applications are valid for 90 days unless it's denied due to any other aspect. Cases closed can be closed for failing to provide, can have a valid set number of days, which is the 90 days from the application date to provide that information. So if they receive a notice saying, hey, your case has been closed or denied for failing to provide the information that they needed to provide, if they get it turned in from that period forward within that 90-day window, they can be reopened or redetermined based on the date in which they send that information in. But anytime a case is closed and it's they don't get that in for that 90th day period, they would need to require a new application at that point. Okay, and then through the application process, the state will require some verifications if need be, and those verifications include income, whether that be from self-employment or from a specific job, or even unearned income, whether it's annuities or dividends or stuff like that. Resources are only going to be applicable to our non-Magi categories. So if you're applying for any one of those non-Magi groups or categories, at that point you would be required to provide your resources to get an eligibility determination at that point. Then we do have a category for expenses. So for our non-Magi side, because sometimes their resources do push them a little bit close, we can list some of those expenses as a deduction per se and get them into a category that could be eligible for. Magi, we do have a couple of things that we can do. Self-employment expenses are a big thing. For those clients that have jobs that, they're cash jobs or they're on, in fluctuating schedules, we maybe consider those sometimes self-employment. As long as those clients keep and can document the expenses that they contribute to that job, we can deduct those from their overall income and get them determined into a category as well. The one thing that we're really trying to stress is that the state is trying to go away from this paper process. So we do have a couple of interfaces that we use to get some of that information that a client may have a hard time providing. We have the work number, which is a third-party agency that collects tax revenue that's provided from businesses that can prove that the employee is working there, and we can get employment verification based on that sometimes. Otherwise, the client is responsible for either providing pay stubs or other employment information to us to get that determination made. And we'll talk later on as far as NFocus is concerned, Access Nebraska is concerned. They can do that electronically now as well. They can send those in versus using the slow snail mail, and that increases the process as well. Went through that a little bit quick. Does anybody have any questions on the information that I covered so far? Yes?
So if a family applies electronically, how long will it be till it's come back?
Right now, we are mandated that it has to be 45 days to process an initial application. The state right now, I think, is running at a 30-day window. So we're under that guideline. Of course, we want to see that number go down. We want to get the determination made and back to that client as quick as we can. The one thing that you can let clients know is that based on that application date, they are guaranteed to get that determination made back to that date. So if they have medical expenses or something that has come up, once that Medicaid kicks in, it'll cover back to that date. We do also have a couple of categories where they can request retro benefits. The client has to stipulate that based on application or in a conversation or some type of communication with the worker. But they can request to get up to 3 months retro benefits back. With that, we have to get all the employment information. We have to make that determination to show that they were eligible for those months, but we can go back 3 months based on that.
Just for recording.
Yeah. Yes.
Will you repeat the question?
Oh, okay. Okay. I'm sorry. Yep. Yes.
Does child support, or does Medicaid initiate the child support process?
Okay, so the question was, does Medicaid implement the referral for child support? In a lot of cases where we have bio parents and they report that there is a bio parent outside of the household, that is a lead that we potentially can use if they are receiving Medicaid coverage. It's a requirement that we just submit a referral, then it goes to child support and they handle the rest of it. Medicaid really just stays out of it, but we do make that request if the bio parent is the one that's requesting benefits as well. Yes?
How would you verify no income?
Verify no income. No income is done through attestation from the client, and then we use a couple of resources that we have to verify that there's been no income reported within a 3-month window or whatever, and then we can make that determination. Yes.
I have a question. I know you said that the Medicaid and the child support issues are different, but if the out-of-home parent is required to pay child support, and if they are not cooperating with paying the child support, does that affect the kids' Medicaids?
No, no. So if child support determines, I'll reiterate that question. So the question was, is if child support has been authorized and the non-custodial parent is refusing to pay, how does that affect the household? If it can be documented through child support that there has been multiple attempts or the client is just not paying for it, that is documented on the case, and the kids really don't get affected by that. They're not. The bio parent that's in the household, as long as they're cooperating with child support and is signed off and saying, yes, please go and try to collect this, they're fine as well. It doesn't impact the case at all. Yep. Any other questions?
Immigration status, what specific immigration statuses?
So the question was, what immigration statuses are we looking for? So for our let me go back here. So if they are an immigrant coming into the state, and if they have a valid refugee status, we can verify that through the federal program or the federal SAVE program, and they're good in that instance. There is such a thing as called like a 5-year band, and that's if they are a immigrant that comes into the country, they've done all that they need to do as far as that, but they don't have specifically the work quarters or it's just it's a status set number of years. They sometimes are not eligible for Medicaid. But we look at passport, we look at green card, we look at all forms of valid immigration, and we use those and run them through the federal interface to determine the correct category for that. Okay, the next couple of slides we're going to go through is going to be Access Nebraska. So, Access Nebraska is our homegrown point of access for online screening, electronic application, change reporting, benefit inquiry, and for clients to able to submit documents electronically. The customer service centers and our local offices have access to all the information that comes in through this online interface, and it feeds into our eligibility system, which we call NFocus. This really is the point of access that we are trying to direct everyone to as far as our Medicaid clients is concerned, because it really provides an efficient way of notifying the client or the client notifying us of any changes or reporting categories as well. We have both points of English and Spanish listed on there as well. And so once they've clicked on their desired language, they're taken to this screen. And from this screen, first-time applicants without a user ID is shown to begin by completing an application. And that's under the yellow arrow as well. It's a simple approach where they just click on it and they're taken to an online application form, and they would be able to start that process. The My Account area there, that My Account is basically once they've created an account, and we'll go through those steps on how to create an account, but once they've created that account, that's the area where they're going to be able to see their current eligibility, if there's any correspondence that's been sent to them, and they can send us correspondence as well through this. So this is the kickoff to the Nebraska Access Nebraska online app, it's really important that when clients do create an app, that they do create an account. And there's really two advantages for that, because once they've created that application and they've gone through it, Medicaid for a year, the renewal point comes up. All they need to basically do is go back into that application, and if anything has changed, they can go in and update that. All the rest of the information has been essentially saved in that, and so they wouldn't necessarily need to just go in and create a whole new one again. And that's only if, again, they've created their account. And so, again, these are the actual screens that explain the requirements of completing an application and creating that user account again. And so the My Account basically is just creating a simple user ID and password. Once they do that, all they will need to do is basically click on the create a new user account link. If they are a current user, they would just basically sign in right there and be able to see their information as well. And this is the new account registration, so it's just basically first name and last name, and list all the pertinent information that they would need to basically create that account. It's not address, it's not anything other than just their first name, last name, and the user ID and their password. And once they've done that, then they'd be able to come in, enter in their login, and this is what would be basically them be taken to. And as you can see, the screen has changed a little bit. The benefit inquiry, which was over there in the corner, now is basically been shifted over, and there's preferences, there's renewals able to be established, and all of those are listed there. Really, at the end of the day, if you have a contact with the clients, we're trying to stress that we really want them to create that user account. The mail has slowed down dramatically since Lincoln mail has to go all the way up to Omaha and then come back down to Lincoln. And so we're seeing an increased number of days, up to 3 days, for some of our communication to be going out to our clients and then thus coming back into us. Really, if they were to set up that user account, the communication be right there for them to see. And we're in the process, and we're getting to the point where we're going to potentially try to launch some text messaging apps as well, just to alert them that, hey, go into your account to check because something has been posted. We're trying to get that sort of process started. Our economic assistance folks that will be speaking a little bit later, they have enabled that technology. For Medicaid, it's a little bit different. We have a little bit different security that we have to worry about, and so we are trying to get that established. So the question is, how do I check my benefits? So again, you have the access to Access Nebraska and using the online benefit inquiry. Our clients can also then call into our Access Nebraska Medicaid Eligibility Customer Service Center. Based on their location in the state, they're routed to either a Lincoln or a Omaha local office if they call in those numbers. But the 1-855 number, that can be answered in either Lincoln or Lexington, which is where our two call centers are. Okay, so submission of documents. So I really want to point this out is that, maybe you want to apply today and maybe you've already checked your benefits through the benefit inquiry. But again, when you do that application and our clients are aware that they know that, potentially they'll need to provide 30 days worth of pay, or they know that they're going to need to provide those self-employment ledgers, they can do that right through this. And we're really trying to stress with our clients when we speak with them on the phone that if we've if they've created that user account, to sort of push them into generating that. Now, we know a lot of our, a small portion of our clients don't have access to online or computers, but we're trying to stress, at least to get to those that do, to go through this route. It makes our jobs a lot easier than to get that information in almost within 2 hours, or even shorter than that, and then to actively just work on that case right away. But that capability is there now for them to do that. Okay, and let's see. Oh, and those are just the submitted document screens. So they'll go through and select the file type that they're able to send in. They'll upload it, and then they'll get the verification for the contact information as well. Okay, so I'm sure everyone is familiar with Heritage Health, and there will be a discussion with that later in the afternoon, but I just wanted to list a couple of those things in this presentation as well. So, you know, while you know, the development of Heritage Health was to bring managed care to our clients. It's determined that, you know, they'll be better served having the contact manager through physical health, behavioral health, pharmacy, and overall med health, all coordinated under one agency. You know, where we had a client that was on Medicaid before, you know, sometimes they would go to the emergency room, then go to a pharmacy, and then, you know, and it just didn't seem to be, you know, benefiting them quite like having a true managed care provider is. You know, the vision was to provide that holistic approach to bring all those services under one umbrella and ultimately benefit the client as well. Okay, so Heritage Health, this is their main landing page, and I just wanted to list that if anybody has not seen that. So this system is built on a broker to work directly with the clients. You know, and again, whereas before, you know, our clients, once they got Medicaid, you know, eligibility determination made, it was really up to them to find, you know, somebody and work that out. So now they have somebody working on their behalf. As well as starting this month, we do have MCNA, which is the dental manager provider. That brokerage has started up. And so if you have contact with our clients that are looking for dental services, if they are Medicaid eligible, that broker will start going through and contacting them as well. I know that they're actively going through and picking up providers right now. It started a little bit slow, but it has picked up dramatically, so that is good news for our clients, that there will be more options for them to select from in going to get dental coverage. Okay, so November 1 is the renewal period for Heritage Health. It's the open enrollment. So, you know, again, the dues there are, we need to encourage our members to make their selections so they can have a voice in their care. You know, that if they don't have any changes that they want to see made, they just don't have to worry about it. As long as they're Medicaid eligible, they will be auto-renewed into the current existing programs that they're in. If you know, and Heritage Health will talk about this afternoon, but there's a couple of don'ts there. You can read over those, but you know, we really don't want to tell one of our clients that they just need to opt out of Heritage Health. It really is not. It's really not acceptable to do that at this point. So. Okay, anybody have any other questions about the last set of documents? Okay, yes.
So working in corrections, obviously, you know, if we went online to access Nebraska, we would have to help them fill out the application, but I thought don't they need like an email or something when they apply so that they can keep in contact, or is it through a correspondence?
The question was, do they need to set up a valid email address to receive correspondence? With that specific population, we can understand that they may not have a valid email. We do have a set number of staff that work specifically on those cases. So they would almost have like a case manager if they were either coming out of, or they were on Medicaid and they were going in. Those cases are being handled.
They can still apply online.
Yeah.
Within the 90 days, like,
Yeah.
the 90 days out, they can apply.
Yep.
Okay.
Yep. Yeah, you can apply online without creating an account. You can do that. Again, you won't receive the full benefit package per se of, getting all that communication set up, nor at a renewal point, you'll have to just go in and create a whole new application again. Yep. Yes?
Have you ever considered adding anything to your website, for pregnant women who want to apply for Medicaid, how they can get a presumptive eligibility at certain locations and get Medicaid right away instead of waiting the 45 days?
Presumptive, okay, so there's two steps there. Presumptive and then regular pregnancy determination. Presumptive apps are being handled within the office that they're going into, whether it be a healthcare facility, hospital. We have under agreement facilities across the state that those presumptive applications come in within 24 hours. So they're required, basically once it's completed, they either fax it in or send it in. There's a specific mailbox that those applications come into within the state, and those are going out the same day. Yeah.
There's just nothing on the website when people go because they're pregnant, they're trying to find Medicaid. Have you ever thought of putting anything there that's...
There is a presumptive eligibility website within Division of Medicaid. Presumptive women, I know it's listed there.
Yeah, it's just like when you go to apply for Medicaid on like the main Access Nebraska webpage, so there's nothing that's...
Oh, no, yeah, it's not. It's within the... Yeah, we could talk about doing a link onto the Access Nebraska page. Yeah, we could do that.
Eric, for everyone's benefit, will you just talk a little bit about presumptive eligibility, what that is?
Presumptive eligibility. So presumptive eligibility is a client, female client going in and saying, I may be pregnant, or I am pregnant and I need to get seen by someone quickly. If they are not covered under Medicaid, but it could be assumed that they could be, the presumptive eligibility application would fill out. What that does is that covers that initial appointment that they're going into right then and there, and would be covered under Medicaid dollars once they were determined eligible for Medicaid.
Is that only if it's out of like set location that does presumptive?
Yes. So the presumptive provider list, I don't know how many are in there right now, but when we initially launched that program, we sent letters out to every healthcare facility. We got a great response, but there are some out there that just haven't done it.
And is that on the website?
Yeah, if you go into the presumptive in the presumptive Medicaid eligibility on that within the DHHS site, there is a list of providers there. Yep. Yes.
So if the woman is determined not eligible, is she then responsible for the visit?
Yes, and that is exactly why, because ultimately, and we've found some of our presumptive applications aren't filled out correctly, or there's just not enough information to determine that, and so we have to then go back to them, and if we can't get that information, it's on them. Yeah, and it's to basically go back to that client and say, hey, this visit was not necessarily covered under Medicaid. Yes.
So when you're filling out an application, can you save it without submitting it? So just like, we could go in and help them fill out all the information and then just save it, and when they get out, they can submit on that.
Yes, you could. Well, yeah, only if they have an account, because there'd be nowhere else to save it. If you don't have an account, it's sort of, you have to go in and complete it and submit it for it to be saved. Yeah.
So if you don't have an account, when you go on Access Nebraska and you fill out the application, then when they request that user ID, and this is your first time going on there, you don't have a user ID, and then sometimes, but it asks you that you need to have that user ID in order to get access to get in there. We've had clients that has had trouble with that. Can they still get in under their name or under a guest user, or how do they get in?
The user ID is a part of that account that they've created. If they don't give us a valid email address, or if they don't have email established, that username and that PIN is actually mailed out to them. And they should keep that if they don't remember it. Otherwise, what can happen is they can call in, and we can either reset it or give them a renewal PIN, which then kicks off another statement and is mailed out to them, or if they have email, it's emailed out to them. That would contain both that username and the PIN number associated with it. But it's if they don't have that initial email established, then it's sent out in paper form to them.
So they wouldn't have.
They would not. But what they would be able to do is they would still be able to fill out an app, get all that process started, and then once they get that, then it would be then it would be established. Yep. Yes.
If changes occur, once they've submitted the application, can they go back into my account before they occur on eligibility status?
Yep. So the question was, if changes occur before initial or renewal eligibility has been established, what can they do? Yeah, it's always best for the client to reach out to us. Otherwise, what sometimes happens is that we're working through the app and we get an alert, or we get something that shows a change has occurred, and that just perpetuates that even more. If they've gone in and they've set up the account, specifically on the renewal, they can notify the agency by doing the My Submit button and submit that information to us. There's a correspondence button that they could use to actually send us a correspondence that we could then act on. But yeah, it's always a benefit for the client to reach out to us to aid that process. Yeah.
Eric, do you want to talk about languages available when you call?
Yeah, so right now we have, if a client calls in to our call center or local office, we have a language line option that we can use if they are foreign speaking. Sometimes what happens is that we need to set up a specific time with them to talk, but again, we do have that option of taking that initial call and then getting a translator on a third party to come in and speak on our behalf. Sometimes, again, it may have to be scheduled at a specific time for that to occur, though. As you saw, though, but the online Access Nebraska, that just supports English and Spanish at this point.
Eric, also, what about uploading documents? Do you have clients that say, yes, I have access to the internet, but I don't have access to the scanner? Or Are they submitting stuff, trying to submit stuff?
Yeah. You know, the technology of having a personal cellular device, you know, it's not just taking selfies anymore. We can, you know, if you have Wells Fargo, you can take a picture of a check and it can automatically be uploaded to your account. Same way with us. If it's legible and we can clearly see it, and it can be submitted through Access Nebraska, and we can act on it.
Yeah.
Do you guys have like an app or a widget for phones yet, or is that something you're going for?
EA is coming out with one. Economic Assistance is coming out with one. They got that through a grant. Medicaid, we're still trying to get there. I'm not going to, you know, go into the timing of it because it's all been discussed, but I just don't know when that will be.
So Eric, what do clients say to you is the biggest barrier in completing the application? Like, what is the hardest piece of that for them?
Probably not knowing what they need to provide. And specifically in a renewal, they could, you know, at the initial determination, they could have provided something completely different than what's needed at renewal time. And so part of the renewal process, and we're you know, we're trying to teach our staff as well, is that if there is verification that's needed, we need to spell it out specific. Too many times, you know, I can say that we've been at fault by just saying, hey, provide, you know, your pay stubs. And, you know, pay stubs from where? From when? How many? You know, and so as well as our clients, I think our staff has to be, you know, and we're trying to condition them to be strategic in the approach of, okay, when a renewal comes in, we aren't going to wait for the client necessarily to say, hey, has my case been processed or renewed? We're going to take that at the point in time in which we, you know, maybe can determine that we can't get it to that point of renewing. We're still going to take action on it to say, hey, you need to get this information turned in. Once you do, we'll be able to get that case renewed for you. Yes?
Is child support considered income when determining eligibility?
It's unearned income. Yes. It does. It factors into the parent's case, but it does not affect the child's case.
Other questions for Eric? How is Heritage Health going in terms of, you want to talk real quickly about the 3 plans that there are?
3 plans. So our 3 carriers are in WellCare. Let me get, just so I'm... United Care and Nebraska Total Care. Overall, you know, for a first year, I think we did pretty well. You know, the undertaking of bringing, you know, 230-some thousand people under a managed care provider in 1 year. I think we did very well. Ultimately, I think our clients have benefited from that immensely, just with the total holistic approach for their coverage. Now having the dental provider in, I think that's just going to grow that coverage, and we'll see sort of a total package. Yeah.
Find providers, you go on the carrier website. So if you're with WellCare, you go on WellCare's website to
Yep.
find providers.
Yep.
Is that the same with the dental plan?
Yes, dental pan would be the same. The MCNA, I think, released some communication. We'll get it going out a little bit more. Providers were slow to start, but then picked up immensely once they sort of figured in that, hey, this is the way to go as far as, coverage is concerned. So, yeah. Yep. Okay, thank you.